How I give the greatest foot massage. There is a kind of care that does not need a grand speech. It does not arrive in a velvet box, shout across a crowded room, or demand applause. Sometimes it begins with a warm towel, a quiet room, and the simple decision to hold someone's tired feet in my hands as if they have carried more than miles. Because they have. They have carried long workdays, hard floors, difficult seasons, errands, stress, responsibility, and all the unseen weight of life. And when I decide to give someone a foot massage, I am not just touching their feet, I am telling them, you can rest now. I believe the greatest foot massage is not about squeezing harder, using fancy oils, or pretending I am a professional therapist after watching one video. It is about attention. It is about slowing down enough to notice what feels good, what feels tense, what makes them relax, and what makes them feel genuinely cared for. A foot massage can be romantic, comforting, playful, healing in spirit, and deeply personal. But it only becomes unforgettable when I stop treating it like a performance and start treating it like an experience we create together. Before I touch anything, I ask. That may sound simple, but it changes everything. Would you like a foot massage? Are your feet sore anywhere? Do you prefer light pressure or firmer pressure? Tell me if anything feels uncomfortable. I believe the best touch begins with respect. I never assume someone wants their feet touched. I never push past a flinch, discomfort, or hesitation. A great massage is not about proving my skill. It is about helping the other person relax, and relaxation cannot exist without trust. I also pay attention to safety. A gentle massage may be fine for many people, but I avoid massage over open cuts, blisters, burns, rashes, swelling of unknown cause, infections such as athlete's foot, or a suspected injury. I encourage medical guidance first for people with conditions such as diabetes with nerve changes or foot wounds, circulation problems, blood clots, significant neuropathy, gout, or those taking blood thinners. Cleveland Clinic advises checking with a healthcare provider before massage when conditions such as blood clots, anticoagulant use, acute injury, osteoporosis, or certain other medical issues are involved. If they say that spot hurts, I do not push harder to work it out. I stop. Pain is not proof that the massage is effective. I believe good care listens. The greatest foot massage begins before my hands ever reach their feet. I create a little sanctuary. I dim the lights. I put on music that feels soft and unhurried. I silence my phone. I bring a clean towel, perhaps a second towel warmed gently, and a lotion or massage oil with a mild scent. I make sure the room is comfortable, not cold enough for them to tense up and not so warm that it feels heavy. I may offer water, tea, or a glass of wine if that fits the occasion. I place a pillow behind their back. I make sure their legs are supported. If they are lying down, I place a cushion beneath the calves or ankles so the feet can relax into my hands, instead of straining to stay up. I believe comfort is romance without needing to announce itself. The setting does not need to be expensive. I could be on a couch after a long day, at the foot of a bed with soft music playing, or sitting outside on a quiet evening. What matters is that I make the moment feel separate from the rush of everything else. I am not half watching a game. I am not checking messages between toes. I am there. And people can feel when I am truly there. I never begin with deep pressure. I begin by warming the feet. I place a small amount of lotion or oil in my hands and rub my palms together first. Cold hands can break the spell immediately. I use just enough product to create smooth movement without making their feet slippery or greasy. Then I hold one foot gently between both hands. I do not rush. I let the warmth of my hands settle around it. I stroke from the heel toward the toes with long, slow passes. I use the whole palm, not only my fingertips. I repeat this several times, allowing the foot to relax. I believe the body needs a signal before it can release tension. My hands give that signal. I begin with broad strokes across the top of the foot, then glide down the sides, then cradle the heels. I use light to medium pressure at first and watch their reactions. Do their toes curl? Do their shoulders drop? Do they sigh? Do they pull away slightly? Their body is giving me instructions. I listen better than I perform. The sole of the foot is where the magic often begins. I hold the heel in one hand and use the thumb of the other hand to make slow, deliberate strokes from the heel toward the ball of the foot. I do not jab. I do not rush. I let my thumb travel in a steady line, then move slightly over and repeat. I imagine I'm slowly ironing out a wrinkle in fabric. I start near the center of the heel. Then I work up the arch. Then I move toward the ball of the foot, adjusting pressure as needed. The arch can feel especially good after a long day, but it can also be sensitive, so I pay attention. I believe pressure should feel like relief, not a test of endurance. I can use small circular motions with my thumb in the arch. I can press gently, hold for 2 or 3 seconds, then release. I can move in slow circles across the ball of the foot, where tension can build from standing, walking, exercise, and shoes that have demanded too much. If I find a tight spot, I do not attack it. I soften around it. I use smaller circles. I ask, how does that feel? I let them guide me. The greatest massage is a conversation without words until words are needed. Toes are often ignored, but they can be one of the most relaxing parts of the entire massage. I take each toe gently between my thumb and finger. I start at the base and slowly glide toward the tip. I use a light rolling motion, never yanking or twisting. I may give a tiny, gentle pull at the end only if it feels comfortable to them. I move toe by toe, big toe, second toe, third, fourth, little toe. I do not rush through them like a checklist. I let the movements stay slow and smooth. I massage the space between the toes with gentle strokes, especially if they have been in shoes all day. I believe details are what make care unforgettable. Anyone can rub a foot for 30 seconds, but when I take the time to honor the small places, the toes, the heel, the edges, the spaces between, someone feels the difference. They feel that I did not come to get it over with. I came to make them feel good. The top of the foot deserves tenderness. I use my thumbs or fingers to make gentle strokes between the long bones on the top of the foot, moving from the toes toward the ankle. I do not press hard here. This area can be more sensitive. I use light, steady pressure and slow movement. Then I use my palms to sweep over the entire top of the foot from ankle to toes, as if I am smoothing out the day. I can gently massage around the ankle, not aggressively on the joint itself, but around the soft tissue, using small circles. I can use long strokes along the lower calf if they want that, and if there are no medical concerns, always staying gentle and avoiding forceful work. The entire experience should feel connected. I do not want to massage one tiny spot like I am trying to repair a machine. I want the foot, ankle, and lower leg to feel like one flowing landscape of relaxation. I believe rhythm creates relaxation. My hands should not feel nervous or random. I find a calm pace. Long stroke. Circle. Gentle compression. Release. Sweep. Repeat. The body begins to trust patterns that are kind. The greatest foot massage is not necessarily the deepest. This is where many people get it wrong. They believe pain means progress, so they dig their thumbs in like they are mining for buried treasure. But a foot massage is not an arm wrestling contest. I begin lighter than I think I need to. Then I ask, would you like more pressure? Is that too much? Do you like the arch, heel, or toes best? I believe confidence is asking instead of guessing. Some people love firm pressure on the sole and lighter pressure on the top. Some want almost no pressure at all. Some have tender feet. Some may be ticklish, which means the answer is not faster movement. It is steadier, broader contact with more consistent pressure. If they are ticklish, I use my palms and whole hand rather than quick fingertip movements. I avoid fluttering touches. I move slowly enough that their nervous system does not interpret it as a surprise. And I remember that pressure can change throughout the massage. What feels good after a few minutes of warming up may have felt too intense at the beginning. I stay present. If I want to make the massage feel polished and unforgettable, I use a simple sequence rather than randomly rubbings. For each foot, I can follow this rhythm. Warm the foot with long gliding strokes. Massage the heel with broad circles. Work the sole from heel to ball using slow thumb passes. Circle the arch, then gently press and release. Massage the ball of the foot. Give each toe a slow roll and glide. Use light strokes across the top of the foot. Gently circle around the ankle. Finish with long, calming strokes from ankle to toes. Then I repeat the sequence on the other foot. I do not have to follow this like a rigid rule book, but having a rhythm keeps me confident and prevents the massage from feeling scattered. At the end, I hold both feet for a few quiet seconds. No need to rush into the next thing. I may cover them with the towel, give a soft kiss on the ankle if that is welcome in the relationship, or simply say, "How do you feel?" I believe the ending matters as much as the beginning. It tells the body, you are safe to stay relaxed. A foot massage can feel wonderful. It may help someone relax, unwind, and feel cared for. Massage in general may help reduce stress and tension, but I do not make exaggerated medical claims or present a home massage as treatment for disease, and I am careful with reflexology claims. I may enjoy working the feet slowly and thoughtfully, but I do not tell someone I can cure organs, fix serious medical problems, or diagnose health conditions by pressing a certain spot. Cleveland Clinic notes that evidence does not show reflexology works better than a traditional foot massage, even though foot massage may support relaxation, mood, stress relief, and sleep for some people. I believe the real magic is already enough. My hands can help create calm. My attention can help someone feel seen. My care can turn an ordinary evening into a memory. I do not need to pretend it is something it is not. Technique matters. Warm hands matter. Oil matters. Slow strokes, gentle circles, toe work, and a peaceful room all matter. But the true secret behind the greatest foot massage is emotional. I do not give it because I expect something in return. I do not give it as a transaction. I give it because care is attractive, because tenderness is powerful, because there is something deeply intimate about helping another person release the stress they have carried all day. I believe people remember how I made them feel long after they forget the exact words I said. So I become patient. I move slowly. I ask what feels good. I keep my phone away. I give them permission to relax without explaining why they need it. I make the room warm, the moment quiet, and the touch respectful. And when I hold their tired feet in my hands, I remember that the greatest foot massage is not about mastering pressure points. It is about mastering presence. If you enjoyed this video, please like and subscribe.